So after a long period of time, HHS had set up an advisory committee on long COVID policy. And this advisory committee was staffed with experts, with long hauler advocates, and it had just been formed in January. I think their first meeting was in January 2025. One of the first actions of the Trump administration and of Secretary Kennedy was to disband this committee. So if I was the president, I would be doing the opposite, which is be bringing in advocates, bringing in experts, bringing in the different organizations that harness the lived experience and utilizing them to help inform comprehensive care, treatment, and solutions. Another thing that I would do is that, one of the things that I live personally is as a housing justice attorney, I saw desperation in housing, where I saw, people living in unconscionable conditions because they needed a roof over their head and predatory individuals taking advantage of that. I now have an understanding of that kind of desperation when it comes to healthcare and to chronic illness. I'm 13 months in, I'm privileged, but at this point in time, I will do or try just about anything to stem the series of losses that comes with an illness and a disability like this.
Hmm.
And part of that is because, obviously long COVID is relatively new in the public health landscape, but we have no FDA approved treatments or let alone cures at this point in time. And so I want to specifically highlight the work of Lisa McCorkle, Hannah Davis, and the Patient Led Research Collaborative, which is a long hauler and allied group organization, where they've really highlighted the need to continue funding research and clinical trials.